How do old joint injuries worsen osteoarthritis even after therapy? Imagine a joint that has been hurt years ago. Even after healing, it might still cause trouble down the line. That's because old joint injuries can set off a chain of changes that keep pushing osteoarthritis forward. When a joint gets injured, the cartilage, bones, ligaments, and tissues around it can get damaged. This damage messes with how the joint normally works, making it more prone to wear and tear over time. One big issue is cartilage damage. Cartilage is the smooth tissue that cushions your joints. When it gets injured, it often breaks down and becomes thinner or rougher. Since cartilage has a limited ability to repair itself, this damage tends to stick around and make osteoarthritis worse. The joint surface becomes uneven, which leads to more pain and stiffness. Injuries can also change how the joint moves. They might shift the joint's alignment or make it less stable. This altered movement puts extra stress on certain parts of the joint, speeding up the breakdown of cartilage and causing bone changes that are typical in osteoarthritis. These changes make the joint less smooth and more painful over time. Inflammation is another factor. Injuries trigger inflammation in the joint, and sometimes this inflammation keeps going even after the injury heals. Persistent inflammation can damage the joint tissues further, breaking down cartilage and causing ongoing pain. Damage to the muscles and nerves around the joint can also play a role. Injury can impair how muscles activate and how the joint senses its position. This can lead to poor movement patterns, increasing the risk of falls or further injuries. It creates a cycle where injury and osteoarthritis keep feeding into each other. Injuries can also cause changes in the bone beneath the cartilage. The bone might thicken or become sclerotic, which means it hardens. These changes affect how the joint absorbs shock and can lead to more pain and stiffness. Even after treatments like physical therapy or surgery, many of these changes don't fully go away. Therapy can help reduce symptoms and improve function, but it often cannot restore the joint to its original healthy state. Some injuries set a path for faster osteoarthritis progression, especially in the first 1 to 2 years after the injury. But the degenerative process can continue for many years, gradually worsening the joint. That's why early treatment of joint injuries is so important. Managing weight, strengthening muscles, and adjusting activities can help protect the joint. While treatments can reduce inflammation and improve movement, they might not completely stop the damage caused by old injuries. Understanding this helps explain why some people continue to experience worsening osteoarthritis even after therapy.